If you've struggled with bloating and you feel completely confused about what the heck to do about it, you're definitely not alone and you're in the right place, because today I'm talking with Elena Maganto, who is a specialist in gut health, IBS, bloating, and fat loss. So I'm so excited to talk with her today. Elena, thank you so much for being here with me today. I so appreciate you taking the time to chat with me. And I'm just really excited to hear all the tips and insights that you have to share with us today.
Thanks, Dr. Miranda. I'm really excited to be here. I think this is actually a very hot topic because what we're going to talk about is one of the symptoms that I see the most in my practice, and people complain the most. And actually, there is a lot behind just a simple bloating. So yeah.
I completely agree. I see it all the time in my practice as well. And I think there are so many factors that are going into bloating being so much more prevalent and so hot on social media on both sides of the coin, as far as like, oh, I have bloating, but then also here's what to do to get rid of your bloating. And it makes it even more confusing. I think that's why it's so helpful too to talk about it and really hear, what's really behind it, what's causing it, and what can we really do to optimize our gut health. Before we jump into that, I'd love to hear more about you, because you are an international and national bestselling author and have some incredible background. So I'd love to hear more from you about that.
Yeah, actually, I have a couple of books, the Ketorranean Diet Solution, and that came from my love for food. I love food. And I feel that most people, whenever they enter in a healthy journey, and then we start telling them everything that they have to stop eating, then they get very frustrated and lost. So here the key is to learn what they can eat and then how to play with it. And then you can still enjoy food and don't feel deprived. So that what took me to write those books. But yeah, basically my background is going like really far in actually to when I was a child, because I always suffered from a lot of digestive disorders. I was really overweight compared to the rest of my friends. And as a child, I didn't even know why it was like that. But then when I entered into my teenage years and I got my menstrual cycles, they were completely off. Like I was going to the bathroom every 5 days. Like I was completely a mess. So then that what took me to understand a little bit more about my body and what was going on. That what took me to do my master's in biochemistry to learn everything at the molecular level. And I did a PhD in molecular biology. So I really wanted to understand what was going on in there. Mm-hmm. And then that's when I discovered that there were a lot of things that they were off. Like I went to the doctor and I found I had candida overgrowth and small intestine bacteria overgrowth. And my estrogen was higher than my progesterone. That there were a lot of things that were happening, but basically at the end, they referred me to the dietitian. And the dietitian put me on a gluten-free and dairy-free diet. That was all. My symptoms improved a little bit, but definitely my weight didn't move anywhere. I was still getting bloated. Like my body was still a mess. So I didn't really understand what happened. But basically, yeah, my background was what took me actually to be here today. Like I really wanted to learn more what happens in our body at the molecular level.
And then what particularly, I think a very common entry point into getting into science and medicine. But what then got you into functional medicine? Because I think you mentioned, in talking before, you mentioned sort of a different trigger for that.
Yeah, that's true. So yeah, from being a scientist, working in the lab and trying to figure out things, my background is in inflammation, and I was working with diets and also some coronary heart diseases and IBS. But then in personal experience as well, not experience, but my mother was actually my real inspiration for a change. She suffered from fibromyalgia. I mean, fibromyalgia is the name. The doctors put her in that box whenever she started having a lot of headaches, pain all over the body, like things that the doctors couldn't really explain. And they said, okay, you are in the box of the fibromyalgia. You need to take this cocktail of medication for the rest of your life to just eliminate the symptoms or control them. And she had, I remember, like a huge cabinet full of meds, like huge. And she was actually really devastated to the point that, Elena, I just know there has to be something else. I'm taking all of this and I'm still not getting better. My pain is there. The medication is not really even controlling it. Like there must be something else. So then she ended going to a doctor. It was a conventional medicine doctor, but was specialized also in functional medicine and alternative medicine. And then he started working with her gut and also emotions. My mother suffered from a lot of depressions. And as we know, and we can talk about today, there's a huge gut-brain connection. So by working with her gut, changes in diet, lifestyle, the right supplements, deficiencies, after 2-3 years, she was completely off of any medication and she was fibromyalgia free, which was a condition that she was supposed to live with forever. So I said, this is it. This is what I really want to do, how I want to heal my body, what I want to do to help others in this journey. So that's what introduced me to functional medicine. And now I work with people working with food as medicine.
Yeah, amazing. It's so powerful. And I love stories like that because it really shows, the thing that you're telling you might not always be true. And it's not like we have to be always second guessing, being a conspiracy theorist to everything. In the conventional world, there are some things that they say is true, and it might not actually be true, or it doesn't have to be true.
Yeah.
So that's fantastic that she was able to use food as medicine, like you said, and turn her life around. That's a wonderful,
Powerful.
great inspiration too for you.
Yeah.
Well, I love it. Well, on that note, let's dive in because like you said, there's so much there to talk about with the gut-brain connection and all of that. But to start with the basics, today we're talking about bloating as sort of like the overarching topic. I'd love to hear more about, what could be causing that? What does that really mean? And are there several things that could be causing that?
Yes, so bloating, stomach distension, being gassy, however we want to call it. Like I feel that most people, one of the things that they complain the most, mostly women, is, and I used to relate to this. I wake up with a flat stomach, and as soon as I start eating, I get bloated to the point that at the end of the day, I feel pregnant.
Mm-hmm.
That definitely there's a lot of things behind, not just a simple lemon water just to help you eliminate that inflammation. So there are things that have to be tested, but maybe we can talk about some of the most common. Like one of the most common that I see is definitely maldigestion. That's why when a person start eating, if they don't digest that first meal, then you put the second one, you're still digesting the first one, then you just keep accumulating that and getting bloated. So maldigestion usually comes mostly with protein. That's kind of like the macronutrient that gives the most of the trouble. And most of the time is from having low stomach acid. Like when we think of the truth is that our stomach needs to be acidic to be able to break down the food. Acid is not the problem. And a lot of people that suffer from bloating, they also suffer from heartburn, reflux, and problems like that. And it's not because they are very acidic. Then those persons go to the doctor are going to give them the proton pump inhibitors, antacids, which actually are making things worse because they are blocking our own stomach acid. So when we don't have enough stomach acid, the food is not broken down properly and it's going to start getting fermented by a lot of the microbes. There are a lot of things that can aggravate having low stomach acid, but one of them is, for example, our age. The elder we get, the less stomach acid production. Some people have certain types of B12 anemia that can also cause low stomach acid. Medications, as we said, like proton pump inhibitors, histamine receptor blockers, they definitely cause low stomach acid as well. Then also H. pylori. H. pylori is an infection from a bacteria that can damage the gut lining, and that can cause also a decrease in stomach acid. So when a person feels the reflux, the discomfort coming to the esophagus, it's not many times because of high acid, it's because the air bubbles that are produced in the stomach may have certain traces of hydrochloric acid, And those are going in the esophagus and cause that kind of feeling sensation, but not necessarily because there is a lot of acid coming. So usually is the low stomach acid the one that is causing the distension. So it's very important to identify if that person will have low stomach acid to see what is the treatment that they will need.
Yeah. I'm so glad you talked about it. And you hit on so many incredible points there. But I love how in functional medicine, we try to go to the root cause, and our stomach acid, in my mind, in our digestive tract, is also sort of like the root. That's the first step, basically, in a lot of ways of our digestion. Chewing is an important step that many of us skip too. But right, like our stomach acid, we need that to then be able to do the next step and the next step, because it really is sort of an assembly line that it's happening in our digestive tract. So it is such a key point. It's something that I see a lot with testing, which we can absolutely get into. What other things, and some of the things that can go along with that, what other things can maybe be another very common cause for bloating that you see?
Yeah, so actually one of the things that low stomach acid can induce, but there are many other triggers, is SIBO, which I mentioned that I had myself, or which is a small intestine bacteria overgrowth, and or SIFO, a small intestine fungus overgrowth. Like we all hear about Candida. Candida is a yeast, and we all have it, and not necessarily it's just manifested in a vaginal Candida overgrowth. There are many. Candida can go systemically in many of our body mucosas as well. But I think more than 80% of the people that I test for that come to me with gastrointestinal symptoms, they have SIBO, almost together with Candida overgrowth. It's really, really common, and it's really, really stubborn. I always say that when we are working with SIBO, we have to work with vitamin B. Patience, because there's a high percentage of relapses after treating the SIBO. So this is a journey. It's possible to treat it, but it's definitely a journey for a lot of patients. So that's one of the main things. But basically, when we talk about microbes and we talk about digestion, as you well said, chewing, all of that is important. Our digestive system, I always say, just think about it, goes from the mouth all the way down to the anus. It's almost our entire body. There's so many things that can happen, right? It's just crazy. But then talking about bacteria, we have 3 different types of microbes in our body. We have what we call the beneficial microbes that control a lot of functions in our gut and in our body in general. Those are the beneficial, the probiotic. They are opportunistic microbes. Opportunistic microbes are microbes that we all have. We get them from our mother during birth and breastfeeding. And most of them, they are in the large intestine. And we want to keep them in small numbers so they don't cause any trouble. And that is including Candida, for example. And then we have infections. If we get a parasite, a bacteria, virus, any other pathogen that comes from outside. So when we talk about the beneficial and opportunistic microbes, so we have to think that they are through the digestive tract. The small intestine has some microbes, but not too many. And in the small intestine is where we process a lot of the food. Then in the large intestine is where we already absorb the water and the electrolytes, and we walk up into the stools. But we have a lot of bacteria in there helping in that process. But when the bacteria from the large intestine invades the small intestine is when all the troubles start coming. People start fermenting all the food, mostly certain type of carbohydrates that we eat. That's causing malabsorption. Low stomach acid can cause SIBO, but SIBO at the same time also blocks the production of stomach acid. It starts causing the bloating, constipation, or even what we call traveler's diarrhea, feeling really gassy. Our digestions definitely stop happening properly. And the SIBO can even start damaging the gut lining. And if this is something that happens for a long period of time, we can end up with what is called leaky gut. So it's definitely a big, big trigger that has to be tested always.
Yeah. I love that you just said testing. So I was just going to say, I think this is a good point to say, what do we do? How do we know that we have this? How do we test it and see exactly what's going on?
So there's a couple of ways to test it. The straightforward for SIBO is usually a breath test. When we have that bacteria, there are different type of bacteria, and they produce different gas. Whenever they start eating the food that we are supposed to be processing, then they start releasing a gas that can be hydrogen or methane. That causes hydrogen SIBO or methane SIBO. So the gas that we collect in those tubes let us know if there is an overgrowth and what type of bacteria is overgrown. Usually those are lactulose or glucose testings. So the person has to drink like a very concentrated solution of that carbohydrate to identify if they have an overgrowth because the bacteria is going to eat it. The other way that it will give us more information, not just if the person has SIBO, stool test. So with the stool test, we can identify SIBO, we can identify Candida or other yeast overgrowth, other infections. If the person has difficulty breaking down the different macros, markers for inflammation, so it's definitely much more complete.
And I'm just more out of curiosity, what's your go-to stool test that you like to use?
So I have a couple of them, but I usually go for the GI 360. That's one of my favorite. The GI map of GI 360 are really, really good to identify a lot of the microbes that may be overgrowth in the digestive tract.
Yeah, absolutely. Yeah. And so I'd love to kind of see, with that. So say you have a client or patient doing the testing, what's next? And you don't have to give your whole approach to this, but kind of like maybe like what are some of the thoughts that go into, what to address, how to address it?
So we do all kind of testing, like we do the stool test. We may test for hormones as well because talking about triggers for bloating, we definitely have to talk about stress. And stress, there is a huge gut-brain connections through a highway or of neurons called vagus nerve. So when a person goes through a lot of stress, that can cause vagus nerve malfunction, and then our digestions also stop, and then can cause a lot of side effects, like for example, bloating. It's just one of them. So also trying to identify if the person comes with certain symptoms that maybe there is an underlying condition for hormone imbalance is also key. Also talking about the testing, why I like also the stool test better than the breath test, and that is also related with your question, is because in a stool test, I'm going to be able to identify if the overgrowth of microbes are microbes that are histamine producers or not. So histamine usually is a molecule that people relate, whenever they have an allergy, they take an antihistamine to block the histamine. But histamine is involved in our digestions, so it's good to do the digestion. It also in the connection between neurons in the central nervous system. But the problem with histamine is that a lot of people also end up with digestive issues, including bloating, because they have histamine intolerance. And histamine intolerance could be that they are producing more histamine than the one that the body can break down. And I'm going to put myself in that box. I'm a person that at the genetic level has mutations in histamine receptors. I don't produce enough of the enzyme that breaks down histamine. So I try to identify if a lot of the people that we can get tested like that. We can test the DNA or just the stool test. What is going to tell us if some of those microbes are histamine producers. So it's not that just genetics or lacking the capacity to break it down. Is that some of those microbes activate the production of histamine or they produce it. So that would be a reason why they are reacting constantly to food or anything else from the environment. I see that a lot of people have a high predisposition to environmental toxicity, like mold, heavy metal, pollen, roaches, So more people at the genetic level, they have higher predisposition to react to that. That is increasing the histamine production, and that can cause a lot of digestive issues as well. So we have to really see the whole picture. So after the testing, then we start making dietary changes. That for me is always the first pillar, functional nutrition, because I always think supplements are important, but there's no supplement that makes miracles if we don't work with food. So the type of diet has to be adjusted depending on what we find. If we find that we have SIBO or Candida overgrowth, if those microbes are producing histamine or not. So we will have to modify the list of food that person has to eliminate, but just for a specific period of time. Not a forever type of change.
And that's such a great point, because I feel like so many people, like I'll have a patient come to me who's like, oh, I did a food sensitivity test 5 years ago and it was this list of foods and I don't eat those foods anymore. And I'm like, well, you're here and you're still having issues.
Yeah.
Then it's all their problem, and you're probably like, or you could be risking some, nutritional deficiencies, removing huge food groups unnecessarily.
Exactly.
So that's such a good point.
Yeah, elimination diet, like one of the most common that probably people that are listening that suffer from bloating, that is very common out there, is the low FODMAP diet. So FODMAPs is just an abbreviation for different type of carbohydrates that they get fermented by those microbes. So they cannot be on a low FODMAP diet for the rest of their life. That's what you said. They are depleted from certain nutrients and even prebiotics that are important for some of the beneficial bacteria. So if something is not working after being on a low FODMAP diet for a specific time, it's because there's something else. So that's very, very important.
And I see it too, in my own practice, I'll have people asking about that. And oftentimes I really try to avoid doing the low FODMAP diet unless someone is so uncomfortable, they're just suffering and can't eat normally. Then I'm like, oh, let's do that. Let's avoid those carbohydrates. But otherwise, if we see the problem and we have a chance to kill off those microbes and really get more to the root cause of things, I'm like, let's not even mess with that and really just get to the point of things. So, yeah.
And as we said, even going on low FODMAP diets and treating them with the antibiotics, they may still get a relapse. It's a chronic condition that some people just get recurrent. So it's about also learning how to manage those symptoms.
Now, to keep going along those lines of, our approach with that, you mentioned starting with a diet first and foremost, really going there. Where do you go next? And this can be your big pillars that you like to look at.
Yes, so usually the pillars of health that I follow is the functional nutrition. Like we will clean up all the macros, not just specifically for FODMAP, but maybe there's people that come from eating a very processed diet. So we first have to start changing their diet a little bit, cleaning it up, creating a lifestyle, right? A clean lifestyle more than a diet. Then I work on a digestive health protocol following the 4R program: remove, replace, reinoculate, and repair. So we clean up if there is an infection or an overgrowth. We try to bring back again the capacity to break down the food by balancing the stomach acid production. Reinoculate is a very scary word, but basically just balancing with the good microbes back, because it's not about putting probiotics from the beginning, because probiotics can cause more overgrowth. So everything has to follow a sequence. And then repair is healing the gut lining if a person already has really severe leaky gut, gastrointestinal inflammation. So we have to follow those pillars. Another pillar would be detoxification. And when we talk about detox, it's emotional, body, and environmental detoxification. Their hygiene and cleaning products, the air that they breathe, if they have mold in their house or not. We also test for that. And so we have to, and emotions make us toxic too, talking about stress. So it's not about just following a 7-14, 21-day detox. It's about creating a detox lifestyle with all the tools that protect us against environmental toxicity, or that help us just eliminate it, like having the capacity to eliminate it. There is people with MTHFR mutations that they have less capacity to detoxify. Just trying to identify also that and opening the pathways to release the toxins is very important. And the other one is hormone balance. Always we work in all the areas. Yeah.
Awesome. Yeah. And I love that you keep coming back to the mental, emotional, the stress piece, because it is so prevalent and it's so, ingrained in our physical health as well. We like to think, oh, it's separate, but it really is so central. So I'm glad that you keep, bringing that back up. It isn't just the physical. We also have to address the mental, emotional, the stress component, and the nervous system component, because it is all so tied together.
Yeah, like I get a lot of people telling me, Elena, my diet is so clean. It's so clean. Or today I ate something that I also ate last week, and actually I didn't feel good with it. So what's going on? But it's because maybe that day the person may be more stressed or more anxiety or sad or overwhelmed. And that definitely messed up the communication with the enteric nervous system that is in the gut and can mess up the digestion. So it's not just about what we eat, but our emotions definitely have a big impact.
I agree. And it's interesting to me working with people in their diet too, is some people think that we need to do more restrictions, right? If they're still not feeling well, what else can I eliminate? And in reality, oftentimes the elimination and stressing about what they're eating is making it worse. They're so stressed out. They don't know what to eat. They're afraid.
Yeah.
Yeah, it's like this crazy cycle. So
I love it. I love it because I had that conversation with a lot of my clients. Like, this is like a cycle, it's a loop between the gut and the brain. Like, you have some symptoms, but you start stressing about your symptoms, and just the stress that is causing you to overthink about your symptoms is causing more digestive problems. So it's a whole loop.
yeah. And so breaking those cycles, breaking those loops and addressing all of those areas, I think is so central. Because like you said, especially with SIBO or SIFO, it's so recurrent. And so you really have to address all of those things to really make it like make a big difference in it and keep it going back or less. So wonderful. Well, I want to go back to the histamine intolerance conversation because I mean, I love talking about histamine, especially the connection with the gut and with the hormones. In my world, for example, actually, I have a patient right now in perimenopause who all of a sudden developed these crazy allergy symptoms. And she was like, what gives? And it's that she went into perimenopause and her estrogen is going higher. And estrogen and histamine kind of feed each other.
Yeah.
So I'd love to go back there and kind of hear a little bit more about your approach to histamine intolerance. Maybe we start with how would someone know if they have histamine?
Yeah, that's a really good question. It also comes to my heart. As I mentioned, I have a lot of issues with histamine. My mother, who has fibromyalgia, she also has histamine intolerance. At the genetic level, we have a lot of genes touched. So when a person starts having chronic allergies, even just a simple congestion, not just right after they eat, that can be a sign that the histamine is really high. If they start having certain neuropathies or pains like heart palpitations, itchy ears, itchy scalp, not just the bloating, but even low blood pressure, high blood pressure, there's a lot of symptoms that can happen with histamine, but that person needs to come with other type of symptoms to really identify. But allergies is a really big one, and neuropathies as well. There's different ways to test it. If we just think could be histamine, it could be just a simple elimination diet by eliminating high histamine foods or foods that are blocking the enzyme that breaks down histamine, which is the AO, diamine oxidase. So by eliminating those foods for a certain period of time and then reintroducing them again if the symptoms come back, that means that was a histamine issue. Hopefully they don't come back. But then directly testing could be when we do the stool test. I see in most people when they have SIBO, Klebsiella pneumoniae is one of the most common histamine producers. So that is another way of testing it indirectly. Genetic testing for a lot of people that they just keep having recurring histamine issues. Genetic testing is also a big one. And not necessarily a food sensitivity. Like a lot of people ask me, what about food sensitivity testing? But the food sensitivity doesn't mean that person has an allergy to those foods. But what it means is you are right now sensitive to those foods, but maybe because you have something else. It could be SIBO. It could be Candida overgrowth. We have to really work on those things first, and maybe you are going to stop having that sensitivity to those foods. So yeah, genetic testing is a really big one, or the stool test. Plasma histamine, that's a very straightforward, just to identify. Or even tryptase. Tryptase is a molecule that is released by mast cells, which are the cells releasing histamine. So some people has what is called mast cell activation syndrome, which means the mast cells are overreacting almost to everything constantly. So tryptase is usually a molecule that tends to be high as well when a person has those problems.
Yeah. So you test that in the blood of someone. Tryptase, histamine. Yeah, I think that's so helpful because again, I think that's one that I've been seeing a lot of lately. And it's very rare that I find the person who knows that that's what's going on, that they have something that people aren't talking about. And so it's really good to have that awareness of that because that can be a big trigger and that can be, I shouldn't say, I don't want to say easily addressed, but more simply addressed. If we know what's going on, then we can address it. We can be targeted with that. And otherwise, I think a lot of people do a lot of roundabout things because they're not getting to the actual core issue.
Yeah. And actually, you were mostly with women that are in kind of like in the transition, perimenopause, menopause in that age. Unfortunately, histamine intolerance affect a higher percentage of women than men. We always get lottery. And it's usually when they start manifesting a lot of symptoms, it's usually when we get in that age, because as I said, you said also estrogen has a lot to do. And talking about estrogen and the gut, we have a big population of microbes in our gut called estrobolome, and they control the production of active estrogen. So when there is also an imbalance in the gut, that can mess up with the estrobolome population, and the person may produce higher or lower estrogen as well. So usually at the end is also a loop. And when I work with hormone balance, one of the main pillars I usually touch first is also gut health, because it's just all connected.
Yeah. It's really connected to everything in our body. Our gut health is so central to our overall health. And I do the same with my approach with people. If there's any inkling of anything going on in someone's gut, or if we just don't know, like, actually for my like fertility patients, people who really just need to get to some answers as quickly as possible, we're looking at the gut first because it is so central to overall health, having everything function normally. But also if we have another issue, like, a detox issue you mentioned, there are certain genetic aspects that can make us a little bit slower with detoxification. Well, we need our gut in good health to then even be able to get everything else. It's like that.
We detoxify estrogen through the bowel movement. Right?
Yeah.
Like when we talk about estrogen, it's usually one of the biggest issues, right? When you said about fertility or transitioning into menopause. So not having a good bowel movement, that's already an indication that your estrogen may be suffering as well, just from that fact. But yeah, I also hear talking about histamine and estrogen, that a lot of women that still have their cycles, whenever they are getting closer to the first day of their cycle, then to their period, they have more headaches or more allergies, or they start getting a lot of bloating, like a lot of symptoms that could be related also to histamine, because histamine pushes, estrogen can push histamine levels.
Yeah, completely. And that's something that I think is so powerful about tracking our menstrual cycle and being aware of it, because then it can make sense. These symptoms that we feel like they're so random, it just comes sometimes and then doesn't come other times. Sometimes when we start tracking cycles, people are like, oh, it's happening before ovulation and before my period. It's like, oh, that's when your estrogen is high. Interesting.
It's so powerful.
Those things. Yeah. Oh, it's so interesting. And I just lost the question I was going to ask you from there. That's okay. So many good points. I love all of this. Maybe from there we go to, what kind of, so this is great information with identifying what our issues could possibly be, how we can identify what's going on. I think working with a practitioner, especially when things are really bad, is an important step. But what are some tips that you could give someone that maybe right off the bat they can take action on if they are experiencing bloating, maybe constipation symptoms there?
As you said, testing is key. That's always very important. But if somebody wants to start implementing certain things, I will say the first one is stop being a snake when you eat. Like, are we chewers or are we snakes? I call my husband a snake all the time because he doesn't chew his food. But as you mentioned before, chewing is important, and digestion starts in the mouth, which releases the saliva, which contains amylase. That's already one of the enzymes that help us break down carbohydrates. We have to think about chewing the food like we would be babies, like baby food. We say always 30 to 40 times per bite. For a lot of people, it's very hard if they barely chew it. If they can start with 10 times, that's always better than 3 and then swallow. But not chewing well the food compromise a lot the digestion, and more if the person is having low stomach acid and is not able to break down a lot of the macros. So starting with chewing, and for people, for example, that suffer from SIBO or any type of overgrowth, I know that people tend to think I need to leave all these many hours in between my meals and just have 2 meals a day that are very large. But for a person that has an overgrowth like that, it's better to eat smaller portions more often than 2 larger meals. Because no matter how much you put on your plate, if you are not going to be able to break it down, it's just going to get fermented by the microbes and it's just going to aggravate the digestion even more. So always the key is to have easy digestions. Easy. So another one that comes to my mind for easy digestions, for people with digestive issues, I don't say it's for everybody, is don't eat salad. And I know that is a tough one because a lot of people that don't have time for cooking, they just throw a salad really quickly. And it's okay. But I remember when I had a lot of digestive issues in the past that I was eating a salad, which for a lot of people is like, I eat a salad, I get hungry after an hour. But I was eating a salad, I was feeling I ate an entire cow. My digestion wasn't happening. Like it could be hours with such a heavy digestion. And it's because the roughage of the fiber of the raw vegetables is really hard to process. And for people that have low stomach acid, diverticulitis, diverticulosis, gastrointestinal inflammation, is very important to pre-digest the food, not just chewing, but also try to cook it a little bit. Doesn't have to be overcooked, but just to soften the fiber a little bit.
Yeah. Okay, fine. On that note, to play devil's advocate a little bit here, maybe, how do you feel about smoothies? With
You don't. I eliminate the smoothies from a lot of people's diets when they are using raw vegetables, or I tell them to keep incorporating smoothies if that's something that they really enjoy. But I tell them you can you can use cooked vegetables. For example, like if you don't want to feel you are eating a soup because it's warm, you can just cook it and then freeze it. The same way that you will take a handful of your greens and throw it, you are going to blanch those greens, freeze them in servings in the freezer, and then just add them to your smoothie. Now, I don't like to put a lot of cold foods because the digestive system is like the yin and the yang. We have to keep a balance. And cold and heat, they contract or expand the digestive system. So when a person is really fighting gastrointestinal disorders, it's better to go for not too many cold foods or spicy foods that can take things into the extremes. Yeah. So smoothies is a controversy in there. I definitely prefer it they don't do smoothies.
Yeah. And like you said with salads too, which that could be very controversial, right? Like, oh, a doctor is saying don't eat salads, but like you said, it's not maybe not for everyone, but for people who really can't tolerate those things, they need to be a little bit more mindful about.
Exactly. I wasn't able to eat salads before. Now I can eat my salads. I love arugula, which is also great for detox. I put it all together in a salad. That's kind of like the best one, my favorite one. So it doesn't mean, as we said before, eliminations are not forever, are just for a specific time. So yeah, that's good news.
And I was going to ask about constipation a little bit more. I think it would be great to take a moment to say, what is normal? Because it's something where I think there's still a lot of, we don't know, like people don't know. They're going every other day. And some people don't really realize that's maybe not so normal. So what should we be doing as far as bowel movements?
Yes, so for bowel movement, I say everybody should have at least one bowel movement a day, at least one. So following the Bristol stool chart, everybody should know the Bristol stool chart. Maybe we can throw a link somewhere under
Yeah, I can do that.
this video. So the Bristol stool chart was designed to identify, because everybody's supposed to be looking at their poops every morning if there is something going on. So ideally, we want to be between 2 and 3. And 2 and 3 is considered to be the normal, like soft, normal form stools. Not too hard. Whenever they go in hard or little balls, like M&M's type, then that's constipation. So constipation is not going every day, or you may go every day, but consistency is not ideal. Diarrhea type is when you go every day, maybe more than 5 times a day already, or you don't go those many times because it's already loose stools. So that means there's a lot of inflammation going on. So at least one bowel movement. Coming from a person that used to go away every 4 or 5 days, I thought it was my normal because I just grew up like that. Now I go regularly every day. I share with all of you. But it's something that is very important to talk about food as we talk about food. It's just so important, right? So one tip that I give to everybody talking about tips for constipation So definitely methane SIBO is a big cause for constipation. So we will have to identify it and address it. But a really big one is dehydration or not having enough electrolytes in the water that we drink. Electrolytes deficiency, mineral deficiency is something that happens to a high percentage of the population. So just by adding a little bit of salt, not too much. Of course, if a person has high blood pressure, they have to talk to their practitioner about that. But lack of magnesium, potassium, a lot of those electrolytes can take to constipation. Mostly magnesium deficiency is a really big one.
Yeah.
So just add the electrolytes in the water. Like I encourage everyone to do it. It's so important.
Yeah. That's another great tip and great insight to make sure people aren't missing that. And that could be, like you said, a really key factor with so many other things, like being able to detoxify estrogen,
Fiber.
and things like that.
Yeah.
Fantastic.
Yeah, fiber is a big detoxifier as well to help us with the bowel movement. Now there's a lot of controversy with fiber as well. We should aim, like everywhere it says, we should aim for 20, 30 grams of fiber a day, but not all the fiber is made equal. And the person has an overgrowth like SIBO, there is a lot of type of fibers that bacteria is going to ferment and it's going to cause more digestive issues. If that's the case, the only type of fiber that has been also approved by the Monash Institute, who designed the low FODMAP diet, is the SAM fiber, the water type of fiber. That is pretty neutral for people that may have an overgrowth and they want to add a little bit more fiber into their diet. So that would be good. Otherwise, fiber it can be a weapon in the process of healing. Yeah.
That's great to know about the sun fiber. So for people who can't tolerate even vegetable fiber, or, like you were mentioning, salads and things like that, tend to be able to tolerate sun fiber, guar gum, so they can add that in while they're in their healing.
Yes. Another one that they may tolerate, but not everybody, is psyllium husk. Psyllium husk goes well for diarrhea or for constipation to bulk up the stools or help us move it. And that one can be also better tolerated when you have an overgrowth, but some fiber is usually one of the best.
Right. I feel like that's so helpful because that is another thing that people don't normally talk about or know. It's like fiber, this big category of fiber, and the different types get confusing. So that's so
yeah, they start loading in there is yeah, sorry. They start loading in chia seeds, chia pudding and chia seeds in the smoothie and a lot of type of fiber like that. And that is just clogging the pipes, or if they have diverticulitis, that may aggravate even the problems more.
Yeah. Yeah. So really being tuned in to what each person has going on, it sounds like, and really knowing what to incorporate.
Yeah. I wanted to say one thing also based on talking about fiber and electrolytes and supplements like that. I really wanted to point out fermented foods and probiotics in here. I think that's a very important topic, actually. A lot of people that come to see me, that they have been trying a lot of things. They're already having a lot of fermented foods and they were taking tons of lactobacillus-based probiotics and their symptoms are still there. The bloating, the discomfort. And it's because if a person, for example, has histamine intolerance, they have to eliminate all fermented foods because fermentation causes high histamine. So the food that stays in the refrigerator longer than 24 hours is already fermenting. Anything that is in a container at the supermarket for a very long time is already fermenting. And things that are fermented or aged, they have high histamine. So that's why they may be reacting even more. And the other one is for probiotics. If a person has a small intestine bacteria overgrowth, lactobacillus-based probiotics are going to cause more overgrowth. Very important to clean up first the overgrowth, then put the right probiotics. So that's something that I really wanted to share because not always probiotic is the answer and can aggravate the condition even more.
Yeah, I agree. And I appreciate you pointing that out because you're absolutely right. I've seen it go wrong for so many people. And it is this blanket statement of, probiotics get your probiotics. And they're also created so differently when you're getting a probiotic off of the shelf. That may not even be, what it says it is and everything. So I think that's such a great point to say, they're not going to fix everything and they're not always necessary, and being mindful about fermented foods. Yeah. Do you typically pull people off of fermented foods, especially when they're having a lot of bloating, but then will you put them back in later on?
Yeah, I love fermented foods. I just cannot because of my predisposition to high histamine. I used to load myself on fermented foods before I discovered the genetic predisposition. First, yeah, when we test and we see that if they come with a lot of symptoms right away and they are loading themselves in kombucha and sauerkraut and a lot of stuff, I tell them to slow down, even to stop it for a little bit and then put it back later on. But if we are testing from the beginning and we know there is an overgrowth and SIBO is involved, definitely we have to cut it. Then when we start repopulating again after we clean up the overgrowth, then they can start trying to putting it back if there is not any histamine issue. That's okay.
Yeah. Awesome. Yeah, I'm similar to you. I have some histamine genetics as well, and would have seasonal allergies that I never really thought of, and then it got a little bit worse. It's actually after having COVID, I started having hives on my face, which was very I can't ignore this anymore. Got very aware of histamine. But what was so cool and what I can share with patients too is that I got over it. And now even seasonal allergies are better than they ever have been. And I'm actually able to tolerate the fermented foods and things like that. So it's also putting that all together, my genetics is probably different from yours. And, I have maybe a different tolerance as a baseline, but it also can be we can change these things and tolerate.
Definitely.
We change the underlying environment, the underlying cause. So.
Yeah, you are a great example, and it's totally true. Like I was getting vaccines when I was a kid because my seasonal allergies were terrible. They were even putting me vaccines. And then after I started working with functional medicine and treating those pieces that were missing, then I didn't need to get any of those antihistamine or vaccines that actually are blocking the DAO, the enzyme, even more. We can control it. We can definitely control it and be able to have a normal life. It's not that is going to control it.
Well, on that note, where can people find you?
So, I mean, I'm all over social media, but yeah, they can join me on Facebook, Instagram, also on my website, emaganto.com. I have a contact. And I have a free Facebook group if people also want to join. It's called kind of like my books, The Ketorranean Diet Solution, and it's focusing all kind of tips for inflammation and digestive health. So if they want to join, is also completely free. I run a lot of challenges and things also in that group. So yeah, they're more than welcome. I would love to see them there as well.
And I'll link those below so people can see where to reach out to you if they want to work with you, join your Facebook group, and just learn more from you. You're such a wealth of knowledge. I really appreciate you taking the time to talk with me. This was such a great conversation. I think this will help so many people who are struggling and may not even know how much they're struggling. So I think this will give them some great insights to optimize their gut health and their overall well-being. So thank you.
Yeah, I'm so glad. Thank you so much for inviting me. I had a great time sharing all of this. I hope this can help someone and take some of those notes for those tips, and you will see how the most important is having awareness. My last message is just be mindful and have awareness of what your body and your gut is trying to tell you. And then with that, a lot of changes can start happening.
Absolutely. What a great message. Thank you so much.
Thank you.